Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today are Brittany and Anquinette, and they're both from Helping Hands. Welcome, ladies.
Thank you, Paige.
Brittany, I want to ask you, why did you bring Anquinette with you today?
So at Helping Hands, part of our mission is to improve the health of the uninsured folks in Caldwell County. And health is health, including mental health. And so at Helping Hands, we contract with Anquinette as a licensed mental health counselor to provide mental health services for our patients. So since this month is Mental Health Month, we figured it would be a great time to highlight this particular facet of what we do for our patients.
How many days a week, or is it as needed? Is Anquinette with you?
So right now, it's actually pretty great. Anquinette comes on site for at least 1 day per week, and then we also have the ability to schedule Helping Hands patients or folks who are referred through Helping Hands with Anquinette 5 days a week at her office, which is very, very close to the clinic in downtown Lenore.
Next door.
Next door. Wow, that's very, very close.
Yeah, like I walk out their door and there's a door and then there's my door.
Yes.
Well, I would say that, yes, that is very, very close. So, let's talk about counseling.
Okay.
What if someone's never been to counseling? What can they expect in that first visit?
Okay, so there's two different scenarios. There's private practice, and then there's like an agency. And so the agency, you go in and they do an assessment and they ask you a lot of questions, and you kind of come up with a plan on what it is that you want to work on or what it is you want to do. I have the luxury of being private practice, and so I've been in private practice since 2018, and my sessions are a little bit different, so I can only speak to how I do things.
Tell us how you do things.
It's usually some kind of varying of it. So clients, the way I do it, paperwork is already filled out before they come to session, and so they come in and I explain limits of confidentiality, kind of what my background is. I explained kind of how the process goes. And then the way I explain it is we're just two people on the couch having a conversation. That's all it is. Like, it just happens that I have more insight into why you may have the behaviors or making the choices that you are or doing the things that you're doing. I have a little bit more insight and I can help connect the dots for you. But ultimately, we're just sitting having a conversation with each other. My office is very, very relaxed. I've had a 16-year-old. I used to keep his favorite tea. And so whenever he would come, I would make his tea for him. And we would just sit and talk. My intern, she had a little girl. She was 5, and she was like, "Can we just make popcorn and talk today?" And it was like, yeah. A lot of people, they come, they kick their shoes off, and they pop on the couch, and we just talk. I'm not big in diagnosis because diagnosis is a lot of an insurance thing, because the insurance wants to know, okay, why are we paying you? What are you treating this person for, and why are we paying you? And so if I don't have to have a diagnosis, I don't. The way I see it is, if you have a cold, it doesn't matter if it's called a cold, because the doctor's going to treat your runny nose and your sore throat and your fever, and it just so happened that has a name. So I'm treating the symptoms of depression, the symptoms of anxiety. It has a name, but that name's irrelevant. And a lot of times people don't even know what those names mean. Like people say all the time, "Oh gosh, I'm so bipolar," or not understanding what bipolar really means. So I tell people, we're going to treat the symptoms of what you're experiencing, not so much as the depression because people sometimes get caught up in those labels. And it's like, no, I'm going to treat you not being able to sleep well at night. I'm going to help you figure out how to stop crying. I'm going to give you coping skills to work with the anxiety versus, your depression. Yeah.
You mentioned you tell people a little about your background, so I'm going to ask you, what is your background?
Okay, so I'll just run my spiel through my disclaimer. Okay, so you come to session and you sit down and I let you know, okay, so things are really, really chill here. There's no stress, there's no pressure. We're just here, two people having conversation. I'd say I've been in counseling since 2018. I have worked with kids, I've worked with adults. What you see is what you get. the same person that's here talking to you is the same person that goes to Walmart and does her grocery shopping, is the same person that calls her son and gets on his nerves. I'm not going to be this way and this way and this way. I don't have energy and motivation to do all that. So what you see is what you get. People go to therapy because they want to get better. And the only way that you're going to get better is if I challenge you, if I push you outside of your comfort zone. If I say, you know what, Paige, I think you can do this. That's because I genuinely think that you can do it. I'm not, however, going to push you outside of what I think you can handle, because if I do that and you fail, then you're not going to be likely to try and put yourself out there again. So I tell people that. I give people the limits of confidentiality. I can't talk to anybody unless you give me permission to talk to somebody, because that's one thing that a lot of people worry about is my mom going to be able to call and you give her information? Is, my husband going to know about this? And so typically, if people don't want anybody to talk to someone, I say, okay, well, you can do a release, but do emergency contact only. And by emergency contact, if I'm worried about you or I feel like something's going through and I can't get a hold of you, I will call that person and say, hey, will you tell Paige to give Anquinette a call? That's still not letting them know who I am and where I'm from. They just know a name, and then you can get in touch with me. I let people know about the limits of confidentiality, if I have a release or if I think you're going to harm yourself or someone else. And that is something that I take very seriously. I tell people I will do a well check on you. If I can't get a hold of you and I have reason to believe that you may or may not be okay, or the last time we talked I have concerns, I let people know up front. I will send law enforcement to check on you. I have done it before for somebody that was in Caldwell County, and it just so happened she said, I am so sorry, I changed my number and I forgot to tell you. And I was like, she said, please tell her that I'm okay, and I will call her as soon as I'm done. And then, but she was thankful, because the last time we talked, I had reason to be concerned something happened to her. But she was very thankful that the fact that I reached out and checked on her to make sure she was okay, because in the event, what if she wasn't? I let people know that, I've not had to do an involuntary commitment, that if I feel like, if you walk out this door and I feel like you're going to do something to yourself, I'm going to say, okay, Paige, I need you to go to the hospital. If I'm saying you need to go to the hospital, you can trust and believe that my conscience says you need to go to the hospital. If you're like, nah, I don't think I'm going to do that, then I will explain, okay, so if you say no and I believe you need to, then that means I have to go to the magistrate's office and I have to let them know that I feel like you're a danger to yourself based on what you've told me. And then I explain to the person that process, so they know day one that, okay, if I'm saying these things, and then I've texted people before, hey, you've got 4 minutes to return my phone call or return my text. And if not, this is what I'm going to have to do. I haven't only had to do that, but like one time. But
that's good.
Yeah.
What are some, because you said you treat the symptoms, you don't really say you have X.
Yeah.
Because people may have X, Y, and Z.
Yeah.
I mean, it's all possible. So what are some of the symptoms you may see?
A lot of irritability, sleeping too much, sleeping not enough, changing appetites, nightmares, and here's a big one. So part of the criteria for depression is thoughts of death and dying. And so people are so scared to admit that when they come in, because I'll get to the last question of, have you had any thoughts of hurting yourself? And you can see, and then that's when I say, okay, listen, part of the criteria for depression is thoughts of death and dying. And they're like, is it? And I'm like, yes. You may have been driving down the road and you thought, oh, what if I just turned it a little bit too far that way? And people are freaked out by that because they're like, I don't really want to do that. Why am I thinking that? Well, that's part of a symptom of depression. Some people have psychosis where they hear and see things other people can't hear and see, which is not really common, but it does happen. Mood swings, crying, racing thoughts where something may have happened, or maybe somebody feels guilt and shame about something, and it's just on a loop and it just keeps going and they can't stop.
Brittany, and this may not be a question for you because I know you're not in the clinical world, but for your providers, how do they know when to be like, hey, we need to call in Inquinet and...
Yeah, well, it's part of their part of the assessment process for visits is to kind of check in with the patient and to know what is appropriate for the medical provider to support with, and then what would be more appropriate to be addressed by the counselor. So that's just a part of the assessment for every patient, and not every patient needs a service like that or needs help, but for the ones that do, I'm incredibly grateful that we have a partnership to be able to access that care in a way that doesn't cost the patient any additional money or anything like that. So, yeah.
And the good thing about me being right next door and me being contracted is, like, I have people, Wednesday's not a good day.
Yeah.
She works different days every week, and so when she gets her schedule, she lets me know what day she's off, and then I can see her because I have my office, so they're not limited to just the day that I'm in the office. And also they're closed on Friday.
Exactly.
I can see people on Friday.
So a lot of great ways to reach out and connect with folks.
Yeah.
I don't know the appropriate way to ask this, but I know sometimes people go through life events that may trigger the need for counseling. Others, it may be, events from a long time ago in their life. So give me some examples of maybe life events where people, you guys see, okay, maybe this person does need to reach out and talk to somebody. Are there some of those things that come up?
I think about separation. Like when husbands and wives separate, sometimes that bring up abandonment issues from childhood, because the feelings of abandonment and oh gosh, she's leaving or she's leaving. Things with children. Sometimes kids are misbehaving or they're doing things, and the parent has this expectation because of what they were doing at their age. So they don't understand what the kid's going through, because when I've heard, well, when I was that age, I was working and I had a license and I was doing this, and meanwhile their kid doesn't want to leave the room and they're tired all the time. And so having to get them from out of their childhood and recognize, like, this is a completely different situation. Sometimes just motherhood struggles reminds women of their relationship with their mother and how toxic it could have been, or how loving, or whatever it was. Because I even think about, like, sometimes mothers and daughters, or mother and sons, they don't have a close relationship like that mother would like, especially if her and her mother were close. And so she's seeking that. Why doesn't my kid want to be around me? Why does my kid not spend time with me? Why does my kid not love me? But they're basing it off of when they were a kid with their mother and the time that they spent together. I see a lot of that. I see a lot of people not meeting their own expectations, but when we trace it back, it is parents had this expectation, and so they made an even higher expectation to get that parent's validation. And so the bar just keeps being risen, and now here they are 34 years old and they're not meeting their own expectation. And I'm like, who are you trying to get validation from? And they're like, oh, no, you didn't say that. Well, that's essentially what you're doing. You've put so much pressure on yourself that there's unrealistic goals.
Yeah.
So.
Another thing, that I ask questions as they pop into my head.
Absolutely.
Brittany is used to that. For someone who enters counseling, I know it's not a one and done. I mean, they're not going to walk in your office and you're not going to have a magic
come out
fix.
with the resolution after one visit.
I mean, that's not realistic. Is there like a time span? I know it varies from person to person, but what can a person expect when they enter counseling as far as
I say that's a lot of that's based on how hard they're willing to work and how much they're willing to look into themselves and make changes. Because some people come and they think they're ready, and then when we start unpacking, they're like, psych, no, I'm not. I thought I was. And then they just disappear. And then some people, they're halfway in and halfway out of it. They're kind of like, I want to, but I'm kind of not going to push myself. And then I've had some people that come in and they're ready. And they put the work in, and So I don't want to keep people for a long time. Some of my clients are mad at me about that. I had one argue with me because I was turning my schedule, and she's like, hey, why are you turning so many pages? And I was like, oh, because I was going to schedule you 6 weeks out. And she was like, no, I'm not doing more than a month. And I was like, but you're fine. And she's like, but what if after a month I'm fine and then I still have 2 more weeks to wait? And I'm like, but see, here's the thing. You can wait 2 weeks. Yeah. That tells me you're okay.
You're doing
well. And she was like, wait a minute, I pay you. Just take my money. And I was like, okay, we'll do a month. But then, so now I've got her where it's a to be determined. She fought that for a while too. But my thing is I tell people I want them to work me out of a job. I want you to get in, do your work, and then you move on with your life. And then, if you need to come back and we need to reassess and do some maintenance sessions, that's fine. But the idea is we're limited and we're going to put the work in and we're going to go. I do a therapy called EMDR, and so sometimes when I do that, the sessions are longer, but a lot of times people heal so much faster. So it may be like a 6-month situation where it could have took me 1.5 years to get through the things that they're going through.
Talk a little bit about EMDR, what it stands for, and that process. So
EMDR is something that was developed in the early 80s, and it was developed for veterans. And basically what EMDR is, eye movement desensitization reprocessing. I always mess up on that word. So basically what it is the left and right, that's the bilateral of the body, and there's the audio with your eyes, there's visual, there's audio, and then there's tactile. And so basically they recognize that whenever veterans were processing things with the back and forth of the eyes, that they were able to eliminate symptoms of PTSD. And so because of that, they had so much success in it that they've kind of just opened it up. And so now people can do EMDR. I was thinking today, because I was going to bring my equipment, but anybody that watches Grey's Anatomy, the soldier on there, he did EMDR. And so my friend was watching it, because I feel like she thought that it was magic or whatever. So, but when she watched it, they had the same equipment that I had. And so she was like, oh, this really is a thing. Yeah. And I was like, yeah, it is. But yeah, he was a veteran and he had PTSD. And so we can treat trauma. I have the ability, and people are like, what? If there's intrusive images that you have in your head and you're like, I could never see that again and I would be fine, I can use EMDR to kind of erase that so that you're not able to see it anymore. Well, I've had kids where they've watched bad movies or a scary monster or whatever, and they couldn't sleep. And so I used EMDR, and I'm like, can you see it? And you could see them like trying to pull it up, and they're like, it's blurry. I can't see it anymore.
Yeah. That's awesome.
Yeah. I've heard really good things about it. That's the reason
it's amazing. It's there's no way to explain the feelings and the outcomes of EMDR. I've had so many people that's went through EMDR, and I was like, if you try to tell people what happened, they're gonna think you're crazy. So just tell them you're doing better. Because they're not going to believe that you held something in your hand and closed your eyes and thought, and now you're better. Because that sounds absolutely crazy, but essentially that's what it is. I have headphones. I use my headphones and my tappers, which they're like little triangle, and you hold them and they buzz opposite, and then they sync up to the headphones and it buzzes. And then there's a light bar where you watch the light back and forth. And I'm able to do it through telehealth too. There's telehealth programs where you can do EMDR and telehealth. Yep.
That's awesome.
So you even, that brings up, you even offer telehealth. So if someone can't get to you, there's no, they can get to you.
They can
get to you.
And another thing is, I tell people, like, I am not committed to these 4 walls. If you want to go walk We can go walk. And there's been times where me and my client will walk around downtown. Me and one client, we tracked the distance, and 2 laps of what we did was a mile. And so I would give her the 8 o'clock appointment in the morning, and I'd make sure I had my tennis shoes, and me and her would walk. I've met people at the walking park, and we've sat outside. The sun's shining, it feels good, it's late in the evening, and I'm always trying to say, get out in the sun, physical activity. And so we went and we walked around the walking park. Like, I'm very flexible. Very flexible.
A lot of good ways to heal, to heal mentally, because when you're mentally healthy, that impacts your physical health.
100%. Yes.
100%. 100%.
And helping hand, I mean, that's your goal. Is
Yes. Yes.
I mean, you can talk a little bit about that, Brittany, is mental, physical health, having healthy folks out there.
Exactly. Treating the whole person so that we can improve the health of the folks in this community who may not have ready access to health care. And that's what we do. I mean, for the folks in this community who are uninsured and don't have access to Medicaid or Medicare, I mean, it's a tall order sometimes to access the health care that you need. So that was a huge part of why at the clinic we expanded to offer mental health services and to offer dental services, and to kind of just look at what our patients needed and where things were lacking for them, and to try to put some programs in place to meet those needs.
That is awesome. I don't have any other questions that have popped into my little head here today, but is there something else you want to add, something that you've been thinking, Paige, I really wish you'd ask about this?
I've got something, I'll go after you.
So this is just a side note, because I have parents that they want their kid in therapy. And so I usually say, okay, so you tell your kid, come down, we'll spend 20 minutes, we'll meet and we'll talk. And if then that kid decides, you know what, I don't like this lady, I don't want to see her. Okay, fine. If not, then we'll set up appointments. And so that works. Because if I can get that kid in my office, 9 times out of 10, I can be like, you coming back, aren't you? And they are coming back. And with that being said, there's adolescents and people that don't want to talk or are uncomfortable talking. So I have spent an entire session writing notes back and forth with the client. Writing back and forth.
Yeah.
I ask a question and I give it to them, they answer it and give it back. And we just sit and pass the note back and forth. I have had sessions where me and that person text. They don't feel comfortable talking. They don't, it's too hard to say certain things. They want to be able to get better, but they're not in a place yet where they can say, okay, this happened to me. And so we'll pass notes.
Yeah.
That's something I've never even thought about.
Yeah.
Well, and something else that we've implemented since you started working at the clinic is we've seen an influx in our patient population of folks who primarily speak Spanish, or the English isn't their first language. And we thought this was going to be really hard to facilitate counseling visits with someone who doesn't speak the same language as you, but we have a live interpreter app that works incredibly well. I mean, it doesn't seem like it's very intrusive.
Oh, no.
I mean, so it has been incredibly helpful to make counseling accessible for folks who maybe don't speak the same language as you. So
and I will say that population has been very, very receptive to the whole it's me, you, and we have a tablet with somebody here that I speak to, and he takes it and then he tells you what it is that I said. And I didn't know how it was going to work out. I was like, okay, we'll see. But it doesn't bother anybody, honestly. They really don't have a problem with it.
Surprisingly so. I mean, and it's just been so that was an incredibly positive, outcome, because we were a little worried about that. So, but it worked out really well.
I'm excited to see this service being part of Helping Hands. I knew you had it, but I hadn't, we hadn't really talked about it. So that's awesome. And I'm glad you're here in town.
Yes.
Right next door.
Right next door.
Right on Harper Avenue.
right down the street.
Yes.
Brittany, as we close, tell us how people can reach Helping Hands.
So I would recommend that if someone's interested in our services, if they have questions about how they could enroll, or if they want to support our work or volunteer or want to share information, just give us a call. And I think that we can put the phone number on the screen. That'd probably be a
Yes,
good plan.
we can.
And then or folks are more than welcome just to stop by the clinic. I mean, if they would like a tour, if they'd like more information about what we do, we're there Monday through Thursday, 8 to 5. So
Lunch break 12:30.
yes, lunch break's 12:30 to 1:30. So, but we'll be back.
She'll be back. All right. Thank you, ladies, for joining me today.
Yeah.
And thank you for watching Caldwell County Today.